Hello, everyone, and welcome. My name is Adva Saldinger. I am a senior reporter here at Devex, and it's my pleasure to welcome you all to this conversation, which is the final in a series of conversations we've had connected with the UN General Assembly meetings. For years, the world was making steady progress on improving health outcomes for women, children, and adolescents. Between 1990 and 2018, the newborn mortality rate almost halved globally. But what we've seen is that with the COVID-19 pandemic, many of those gains are being reversed. In many low and middle income countries, health services for women and children dropped by 25% during the pandemic. And there's been a rise of stillbirths and maternal deaths, and contraceptive use has been disrupted for about 12 million women in 115 countries. On top of the health implications, women have also borne the brunt of other secondary impacts of the pandemic. Dramatic increases in gender-based violence, school closures, job losses, and increases in unpaid care. Today, we're going to be discussing the scale of the challenge that some of these trends pose, what can and should be done to address these sort of knock-on or secondary effects on women and girls to sort of stop the slide and get back on track. I'd like to thank our partner in hosting this conversation, the Global Financing Facility for Women, Children, and Adolescents. And before we get started, a quick housekeeping note. We have simultaneous interpretation in English and French, so please select your language of preference. And now, to start our conversation, it is my pleasure to introduce her Honorable Professor Aura Marie Kolsek, who's the Minister of State for the Republic of Senegal, and Mamta Murthy, the Vice President for Human Development at the World Bank. Thank you both so much for joining us today and being a part of this conversation. Minister Kolsek, I wanted to start with you. I've listed some of the statistics, but I'm hoping that you can help people understand the impact of the pandemic on women's health in Senegal. How can you sort of paint that picture for us? What are you seeing? What are these impacts on women and girls?
Je vous remercie pour cette question importante et qui me rappelle vraiment la réalité de terrain. Bien sûr, vous avez donné des chiffres qui correspondent à la réalité dans le monde et particulièrement dans les pays en développement. Et moi, je vais essayer d'axer mon intervention plus sur le Sénégal. Il faut dire que la pandémie qui a posé autant de problèmes aujourd'hui dans le monde n'a qu'un an et demi, ce qui fait qu'il n'y a pas de recul vraiment clair sur les chiffres, mais il y a une réalité qui est là, c'est qu'on voit qu'il y a un vrai problème par rapport à l'offre et à la demande de soins. Si vous voulez quelques chiffres concernant le Sénégal, il faut dire que nous avons tous constaté sur le terrain qu'il y avait, disons, une situation qui était quand même très grave. On a remarqué des perturbations partout dans le système de santé. Mais quelques chiffres aujourd'hui, puisqu'en général, les statistiques se font toutes les années ou tous les 5 ans, il y a simplement qu'on s'est rendu compte qu'il y a une diminution, par exemple, du taux d'immunisation chez les enfants, parce que pendant longtemps, les enfants n'ont pas été pris en charge dans le système de vaccination. Mais il y a eu des modélisations qui ont été faites justement pour cela. Et tenant compte de la pandémie et de la réalité sénégalaise, les modèles mathématiques ont montré qu'il y avait, par exemple, plus de 300 000 enfants qui n'avaient pas accès aux antibiotiques pour la pneumonie, plus de 500 000 enfants sans vaccin contre la diphtérie, le tétanos ou la coqueluche. Mais également, ce qu'on a remarqué, c'est que beaucoup de femmes, presque 100 000 femmes, en moins ont eu à aller dans des établissements de santé pour l'accouchement. Et 250 000 femmes n'auront pas accès aux structures de planification familiale. Ce sont donc des chiffres qui montrent qu'il y a un vrai problème au niveau de l'impact, disons, de la COVID-19 sur le système de santé et sur les indicateurs de santé. Mais il faut dire que cela est lié à un fait important, j'en parlais tantôt, c'est le problème de l'offre. Le personnel a été réorienté, est tombé malade. Certains sont décédés, donc il y a une pénurie en personnel. Les établissements de santé sont submergés aussi par de nombreux patients, surtout quand on est dans des pics de vagues, puisque la COVID-19 évolue en vagues dans nos pays et au Sénégal, nous sommes à la 3e vague qui semble s'estomper aujourd'hui. Nous avons aussi eu des problèmes d'approvisionnement en médicaments et en tout ce qui était vraiment équipement de santé. Et il faut dire aussi qu'il y a un problème de demande. Les gens ont eu peur d'aller dans les structures parce qu'il y avait des risques pour eux de contamination. Mais également, un autre problème, c'était qu'il y avait des restrictions, il y avait des confinements, des restrictions comme le couvre-feu. Donc, tout cela a empêché aussi les personnes, surtout les femmes et les enfants, de se présenter dans les structures sanitaires. Il faut dire qu'il y a eu aussi un impact sur d'autres secteurs que le secteur de la santé qui a eu des répercussions sur ce secteur-là. Une perturbation dans les emplois et donc dans les revenus, ce qui fait que les personnes n'avaient pas de quoi payer et n'ont pas de quoi payer dans les structures de santé, mais également dans les transports pour aller dans les structures de santé. Ce n'est pas unique à COVID-19, puisque avec, par exemple, le SARS à l'époque, il y avait une baisse de 24% pour les services ambulatoires. Et pour Ebola, qui a touché aussi le Sénégal, il y a eu moins de 18% de recours aux structures sanitaires. Voilà ce que je voulais dire. Je pense que c'est important de savoir que la COVID-19 a vraiment perturbé le système de santé et j'espère que nous pourrons après discuter de qu'est-ce qu'il faut faire parce que c'est un vrai problème. Je vous remercie.
Absolutely. We wouldn't be having a productive conversation if we didn't address where we go from here. But I think it's really useful to sort of understand the picture and the type of disruption and what's driving it. Mamta, I want to turn to you. What would you add about what we're seeing? And one of the questions I have is that, we have seen some countries that on top of the pandemic are also dealing with increased violence or instability. And so, you're sort of mounting on top of the, crisis of COVID, all these other instabilities. And, one example you can look at is Afghanistan, and as aid programs are disrupted, how in these sort of most fragile contexts are we seeing these secondary health effects and livelihoods effects on women and children being impacted?
Thank you, Alva, for your very important question. And it's a real pleasure to be again with you, Minister Kolsek. So from our perspective at the World Bank and with GFF, without a doubt, we see both the impact of COVID-19 and the secondary health crisis. And our efforts have been around supporting governments in responding to the pandemic, but also strengthening primary health care so as to make available essential health services that people need, especially women and adolescents and children. So we have mounted the largest ever crisis response in history. We are the largest external financier of health, And the support that we have provided to governments runs to several billions. It's around 8 or 9 billion at this point, counting from March 2020. This support is to both fight the pandemic, but very importantly, it's to help people access essential health services. And Minister Kolsek gave a very clear account, saying there's the supply side issues and there's the demand side issues. And we try to support through our financing both. So on the supply side, there's support for staff, for healthcare workers, for personal protective equipment, for training, for stakeholder engagement, for community engagement. And on the demand side, there is support through cash transfers to support livelihoods, because very often the demand for health services falls because of not being able to go to a health center or access transport. I'm very happy to say that GFF was also able to approve emergency health services grants in countries where it was clear the resources were not enough. And these too have helped in addressing the supply and the demand side issues. Now, you raised the question about fragile environments, and these are the most difficult environments to support essential health services in. But typically we work with partners so that especially agencies that have very wide outreach in countries, also agencies that are able to operate even during a conflict. And without partnership with these agencies, we would not be in a position to support the provision of health services through our financing. So our many partners, WFP, ICRC, UNICEF, really none of this support would be possible without that. I've talked exclusively about financing investments in healthcare, but let me mention a very important aspect of the work that we do, which is around mapping of resources and helping governments prioritize the use of resources for health. And this is ground level work, working with both ministries of finance and ministries of health. It's very important to ensuring that resources go to where they are most needed. So it's this combination of both investments, analytical work, and technical work, of course, led by governments and done in support with partners, is how we are supporting the delivery of essential health services.
Well, on that note, I want to go back to Minister Kolsek, because obviously governments have a huge role to play in sort of addressing this challenge. So what do you see as sort of your government's role? How are you responding in Senegal? And I know you're thinking a lot about how to make health systems more resilient and sustainable in the long term, and sort of the role of governments in ensuring that there's sustainable sources of financing, et cetera. So what can you tell us about, what role you think governments need to be taking on and how you're responding?
Merci beaucoup. Je pense que nous avons déjà posé deux problèmes, c'est-à-dire la réalité du terrain et surtout quand il n'y a pas d'intervention, où est-ce qu'on pourrait arriver à vraiment remettre en question tous les gains que nous avons eus antérieurement. Mais également, nous avons montré qu'il y a des structures d'appui, il y a par exemple la Banque mondiale, il y a le DFF, toutes ces structures qui appuient les pays. Mais il faut dire que la réponse est surtout une réponse locale. Ce que nous avons vu, en tout cas au Sénégal, c'est un leadership fort au plus haut niveau qui a permis vraiment de réagir à cette pandémie, qui était pratiquement une pandémie qui venait détruire tous les acquis qu'il y avait eu dans les pays. Et nous avons proposé une réponse multisectorielle, parce qu'il faut aussi qu'on comprenne que même si c'est une maladie, l'impact est tel dans les autres secteurs qu'il faut surtout ne pas la médicaliser, mais penser à l'étendre aux autres secteurs pour qu'il y ait une réaction beaucoup plus importante et beaucoup plus adéquate. Il faut dire également qu'en plus de cette approche multisectorielle, on a vraiment préconisé une approche communautaire impliquant les leaders communautaires, mais également toutes les ONG, les associations communautaires de base et certaines personnes qui étaient considérées comme étant très importantes dans la communauté, comme ce qu'on appelle au Sénégal les badianou gor, ce sont les marraines de quartier, ces femmes qui peuvent entrer partout et qui peuvent parler à tout le monde des problèmes de santé. Et ça, c'est une approche communautaire que nous avons stimulée. Il faut dire aussi que nous avions beaucoup pensé au secteur de la santé lui-même et aux agents, au personnel de santé qui était très engagé, qui a pu avoir très vite tout ce qui est équipement, même si les approvisionnements étaient difficiles. Grâce à nos partenaires, grâce à des amis, nous avons pu avoir vraiment tout ce qu'il fallait pour le personnel de santé, qui lui a été un personnel aguerri, puisque nous avons eu à quand même les tester pendant l'épidémie à virus Ebola, où le Sénégal a eu, disons, un comportement et une réponse qui était adéquate. Il y a également ce qu'il faut faire, et la chose sur laquelle nous avons beaucoup travaillé, c'est les partenariats. Et c'est pour ça que nous avons eu beaucoup d'intérêt à travailler avec le GFF, parce que c'est une approche partenariale qui nous a poussé d'ailleurs à mettre tout le monde autour d'une table pour réagir et pour dire, voilà, il n'est pas question, il faut nous battre contre le virus, mais il nous faut également ne pas oublier les autres secteurs, surtout les secteurs qui prennent en charge les populations vulnérables, comme les femmes et les enfants. Et c'est grâce à ce partenariat au niveau local que nous avons pu mener certaines grandes batailles. Je voudrais aussi dire que tout cela a permis au pays d'être plus résilient, parce que si je prends l'exemple du leadership au plus haut niveau, ça je pense que c'est important d'en parler, il y a eu un fonds COVID-19 qui a fédéré tous les efforts nationaux et internationaux et qui a pu aider vraiment les populations vulnérables. C'était des aides plutôt sociales, mais également, depuis quelque temps, il y a eu aussi un grand programme pour les jeunes, puisqu'on a parlé tout à l'heure d'emploi, et c'est les jeunes qui sont les plus touchés par le manque d'emploi. Un programme sur 3 ans pour vraiment aider les jeunes à gérer cette situation difficile. Je voudrais, en résumé, dire que ce qu'il faut, et notre réaction a tourné autour d'un mécanisme de coordination au niveau national pour l'aide d'urgence et sur le long terme. La création, par exemple, il existait déjà, mais nous l'avions renforcé au départ au niveau de la première réaction.
Le centre. Minister, I hate to jump in, but we're running short on time. Okay. But I do want to ask Mamta and you one last question, which is, you know, this challenge around sustainable financing and looking at the long term. And Mamta, you talked about this mapping of resources. You know, one of the discussions for a long time has been how to marshal more domestic resources and how to help countries put more of their own funding towards health. There's been some big commitments across the African continent, and many countries are still falling short of those commitments, often because they're facing crises and are unable to sort of meet them. So Mamta, how are you looking at sustainable financing? And then maybe for 1 minute, we'll come back to you, Minister, as well, on sort of what's the path to sustainable financing to ensure more resilient health systems?
So thank you, Alva. What we're trying to do and what we've done, and this is really a partnership with with government, with it's a partnership between GFF and the bank. We've tried to map the resources that are available, both at the general government level, and then based on what's happened in the past, what's available for health. And what we find is that per capita government spending on health is not going to be adequate. As if we project it forward for the next 5 years, it's not going to be adequate to meet three things: to fight the pandemic, to address the secondary health crisis, and that means, you know, making progress towards universal health coverage, and thirdly, building resilience, making the health system more resilient. And based on this analysis, we are making 3 points. First of all, governments need to prioritize health as a part of their spending. And this is going to be difficult because there are many demands for resources, but without that, it would be very difficult to do these three things that I've talked about. Second, the international community needs to step up because they can be an important source of resources for health system strengthening. And third, it's very important to look for efficiency, to be able to do things in a way that is more efficient. So if I may, I'm just going to make a small plug at this point for both IDA and GFF, which are going into replenishments, because the bank and GFF can play an important role in the external financing part. Of course, we can also support on the technical side, and we intend to continue doing that. On the technical side, to support resource prioritization and looking for efficiencies. All of this needs to be government-led. So I'm so happy that you're asking the last question to Minister Kolsek.
So Minister Kolsek, I think building on that, one of those key necessities in achieving some of these goals is that countries prioritize health, including in their budgets. Is that something that we can look ahead to Senegal doing more robustly in the future?
Je crois que même s'il y avait des hésitations à un moment donné, il y a eu vraiment, comme on dit, un coup de tonnerre avec la COVID-19 et tout le monde s'est rendu compte que sans santé, il n'y a pas de développement. Donc, investir dans la santé, c'est ce qu'il y a de plus rentable. Et je peux dire qu'au niveau du Sénégal, il y a eu même des réallocations budgétaires, etc., parce que c'était vraiment la priorité. Mais il faut se dire aussi qu'il faut mettre plus de moyens. Il faut qu'il y ait, disons, en même temps un développement qui permette au pays de pouvoir utiliser les moyens d'une manière la plus efficiente possible. Et donc, la santé est une priorité, mais n'oublions pas l'éducation, n'oublions pas d'autres secteurs qui interviennent, qui sont des déterminants de la santé. Donc, la santé au sens large du terme, c'est vraiment important aujourd'hui. Et c'est pour ça que nous avons accepté, le président de la République, de co-parrainer justement cette campagne de mobilisation de ressources du GFF avec la Banque mondiale et aussi le Canada. C'est parce qu'on considère que c'est un mécanisme de partenariat qui aide les pays à être plus efficaces dans les allocations et dans les investissements qui sont faits dans le domaine de la santé, surtout pour les femmes et les enfants.
Wonderful. Well, thank you, Minister, for being with us. And we look forward to hearing more in the future about what Senegal is doing and accomplishing as you sort of ramp up your health financing. So Minister Mamta, thank you both so much for being with us. We are now going to transition to a panel to sort of build on and continue this conversation. And it's my pleasure to introduce Noliette Kabanyana, who's the Executive Secretary of the Rwanda NGOs Forum on HIV/AIDS and Health Promotion, Dr. Chris Elias, the President of the Global Development Division at the Bill and Melinda Gates Foundation, Dr. Jennifer Adams, the Acting Assistant Administrator at the U.S. Agency for International Development's Bureau of Global Health, and Dr. Monique Vletter, Head of Secretariat at GFF. So I'm intimidated by all the doctors on this panel. we'll start by saying that. But I'm very excited to have you join us for this conversation. And to start us off, Noliette, I'm going to go to you. We heard a little bit from the minister about the role of community, and you're working directly with a bunch of organizations who are seeing firsthand how this is playing out. And I know you're working to collect learnings from the experience. So what can you share with us? What can you tell us about the local response in Rwanda and what sort of learnings you have found in the last 18 or so months? Noliette, I think you're muted.
Thank you very much, Adva. The Minister of Senegal has highlighted how COVID-19 has really impacted the lives of women, children, and adolescents. Coming back to Rwanda, it's the same as it is across the region and all over the world, because we've seen that the COVID-19 has exposed many health system weaknesses. And we have also seen that the African government has been pushed to shift many priorities to quickly finance those critical gaps that were shown up by the COVID-19 pandemic. For example, if we talk about the provision of sexual reproductive health services, these are the critical issues that were identified, that were highlighted, that were shown by the COVID-19 pandemic, where the governments put in place the lockdowns, where there were restrictions of movements of people from one place to another. So it made it very difficult for women and young girls and adolescent ones to move to have access on the sexual reproductive health services. That was really, really a problem, because at the end of the day, we've seen how the schools were closed and all the students had to go back home. And this put at the exposure of the young girls and also the women of not having access to sexual reproductive health services. And this had brought them to come up with increase of teenage pregnancies. So looking at the increase of teenage pregnancies, there is a lot of challenges there. These young girls who has got pregnant during this period, since the outbreak of the COVID-19 pandemic. So what's their life going to look like in the future? These young girls are going to drop out from schools. These young people are going to start carrying the burden of having responsibilities. Their children, and now they're going to be responsible for other children. These girls are now living in a trauma kind of life. So there is lack of psychosocial support towards the women and young girls. So I think there's a lot that needs to be done. We're talking about the increase of teenage pregnancies. We can't forget talking about the increase of gender-based violences. Because if these young girls get pregnant, they get pregnant at an early age, then there are conflicts in the families. And most of the times it's women, the mothers, who face these problems, gender-based violence in families. We need also to think about the HIV transmission around these young girls. We know the one way of getting HIV is because you've had unprotected sex. So if we are seeing the increase of teenage pregnancies, what are we thinking about around HIV? So we are likely to see the increase of new HIV infections among the adolescents and young women because of the disruptions of the services. All the attention has been put to COVID-19 response and left behind other health care services.
I'm muted. I think on that note, it's a perfect opportunity to ask some of the funders we have on this call, because I think, one of the challenges with a crisis like COVID is that it can really suck up and divert resources, as you just said. And so I guess this is a question, we can start with you, Chris, but tell me a little bit about how the Gates Foundation is responding. Have you had to divert resources that otherwise would have gone to address some of these health challenges to address COVID? And as you're looking at your funding going forward, how do you ensure that there's sort of a holistic picture so that there isn't this sort of backsliding we've seen on other key health challenges?
Thank you, Adva, and thanks to Devex and GFF for convening this important discussion, and thanks to my co-panelists. And first, let me say thank you to Mamta and Minister Kolsak for a very honest assessment of the GFF. Having served as the chair of the investors group for the GFF for a number of years until recently, I learned that if we're going to understand the GFF model, we need to listen carefully to the countries, because that's where they lead this process of bringing together both more resources and more efficient use of resources for essential maternal and newborn child health programs. And Senegal is a very important experience that we can all learn from. And I think Juliet's comments about Rwanda as well. And I think it's a testament to the value of the GFF. To your point, your question, about resources, most of the resources that the Gates Foundation has committed to the COVID response over the last 18 months have been additional resources, but some of them have been basically finding, if you will, an opportunity amidst the crisis. Let me give you one specific example. Oxygen systems, prior to COVID, the number one cause of death of children under the age of 5 was pneumonia. Many of them those deaths could be prevented with good oxygen therapy. And we were making incremental progress in expanding oxygen availability to children. When COVID came and adults, including very influential adults and politicians, became susceptible, and the lack of effective oxygen systems in many countries was exposed, there was a renewed political commitment for solving the oxygen problem. That, I think, is an opportunity for us to create a durable asset for achieving the SDGs beyond the COVID pandemic. And so some of our resources, I would say, are being dual purposed for response for the COVID-19, as well as continuing to sustain the gains in essential health services. Because as you heard in the specific examples from Awa regarding Senegal, we've had significant improvements in the health of women, children, and adolescents over the previous years, led by many governments, the World Bank, global health partners, including the GFF. Short-term shocks of COVID-19 threatens to turn back that progress significantly. I will give you the statistics from Senegal, but if you look across the world, there's been severe disruptions in essential health services in the GFF partner countries that have resulted in a 25% drop in coverage of life-saving health interventions. That's the equivalent, just to put some perspective on it, that's the equivalent of 82 million children not receiving oral rehydration when they have diarrhea, 17 million children going without life-saving vaccinations, and 4 million pregnant women being unable to access care during childbirth. So I think we have to work together as a development partner with governments, other donors, partners, the civil society, to respond quickly to limit the damage, but also think about the future. And that's where I think we do need to increase our investment now. Otherwise, lives will be lost in this progress, which was hard won, will be undone. So we need to really think about a broader human capital perspective and how we invest to recover from this health and economic crisis. So specifically for the Gates Foundation, as Mamta mentioned, earlier this year, the GFF launched an ambitious but important resource mobilization campaign that was co-hosted by the government of Senegal and Canada, as well as the World Bank, with an aim to reach $1.2 billion by the end of 2021. And this is a tough time to be out raising resources. Donor budgets are constrained. They've got extra needs related to the development and deployment of COVID tools. But the foundation believes strongly in the mission of the GFF and its ability to help countries tackle what in many ways is the primary crisis, which is the loss of essential health services for women and children. So we're, earlier this year, we announced that we're going to contribute up to $100 million, 75 million of which is being used immediately to partner with countries. An additional 25 million that's available as a match to encourage other funders to the GFF or new funders to the GFF by increasing the impact of their contribution. So, that will lead to, tremendous gains, and we don't have time for me to go into the details of the numbers of lives that can be saved, morbidity that can be avoided. The last thing I'd say is that a key part of the GFF model, which was touched on by Mamta and Dr. Kolsek, is this resource tracking and understanding what resources are available. Because what I've seen is the GFF can catalyze a better alignment of bilateral assistance, domestic resources, the IDA concessional lending, and even in some places the private sector contributions to a country-led investment plan. And that improves both the efficiency of the current resource commitments, as well as makes a strong case for additional resource commitments to be made, as you were saying, by country. Thank you.
Great. Jennifer, I want to come to you and sort of ask a similar question about funding. I know USAID has had to pivot some staff resources. There were also challenges, as staff couldn't be in country. And so how is USAID looking at some of this diversion and then looking to address some of these challenges? Noliette mentioned, an increase in HIV/AIDS among adolescent girls, for example. I know that the US government through PEPFAR has the DREAMS program, which is looking to address that issue. It's pre-existing, but how are you looking holistically to address some of this backsliding as the response to COVID is ongoing? Because I think how donors are responding will be a key to ensuring sort of that long-term resilience and stopping this slide.
So thank you. Thank you, Iva. I assume everybody can hear me. And also would like to thank everybody for the opportunity to join this conversation. And I think I would echo a lot of what Chris Elias said. First of all, we really value the partnerships that USAID has with GFF, with the World Bank, with the Gates Foundation and others. And I think that basis of partnership was actually very important in the immediate response to COVID, and continues to be very, very important as we figure out some of the longer term gaps that we need to collectively address. Equally important are for us at USAID are our missions in country, who really since the onset of COVID have worked very, very closely with the national governments, the ministries of health, and a variety of local partners. So we're able to have information that we get kind of from the ground up, and then be able to transmit back some conversations internally about how to pivot and how to readjust. I think we're very fortunate at USAID that in fact we have a lot of new resources, quite a lot of new resources to be able to address COVID. Some of it quite directly addressing COVID, particularly vaccines and deployment of vaccines around the world, which is a commitment of the U.S. government. But also, we're very, very aware at USAID of the impact that COVID has had on existing health systems and health structures. And we know that worldwide it continues to cause these disruptions, especially maternal and child health, and some of the routine care that we have all been working to advance, and are very sad to see these setbacks in part because of COVID. And I can attest to this. I was the mission director in Mozambique until very recently. And when the first wave of COVID hit Mozambique, it did cause a kind of a shutdown. And in those early months, the the reaction was to close the health services. So there were very limited opportunities for, at least in the beginning, for any kind of care, and just critical disruptions. I think everyone has learned from that time of panic and kind of regrouped to be able to move into the future in a better way. And so I guess the last thing I'd like to say is that in doing that and in pivoting our resources and coming up with creative ways to use our staff who are all back in the field now, I think there are a couple of opportunities. So I think one of the opportunities is that this pandemic gave a very visible example of how we need to build resiliency in the health systems and be able to adapt and change when circumstances change so radically. So I think that has given some impetus to everyone to think about that. And I think in some ways, at least in some countries, it's given some impetus to not only the Ministry of Health, but in some cases to the Ministry of Finance, to see so visibly how a health crisis can impact so many aspects of the country and so many aspects of the society and the economy. And I think that may provide some opportunity going forward to look at this question of health and health security with a broader set of stakeholders and a new lens and a new appreciation for the central role of health and health systems in a country's society and economy. Thanks. Over.
Thank you. Monique, I want to bring you into this conversation. We've heard a lot about GFF already, but one of the things that strikes me is that, Chris was saying that we are in a time where it's hard to raise funds, which you're trying to do. And I think governments are also sort of feeling the pressure to prioritize and figure out where do we spend our limited resources? And so in terms of this issue of like the most efficient use of resources, how are you working with countries? What sort of partnerships and processes do you think can sort of best help create those efficiencies in a really constrained financial environment?
Great, thank you so much. And I also want to thank my fellow panelists for all the very thoughtful contributions. Maybe first of all to say that we also today will be releasing new data about the secondary impact of COVID on women and children's health. And it's an actual fact really very sobering. And we've heard this, I think, very well explained by Minister Kolsek and Nuliet in how this is working out on country levels. And so we saw across the GFF partner countries, on average, a 25% decline in access to essential services. So 1/4, 25% decline. So that's really huge. And we now, for the first time, also have the estimates of what the impact is of that decline on the death of women and children. And so for every COVID-related death, 2 women and children died over the last 18 months during the COVID pandemic. So for every 1 COVID-related death, there were 2 women and children that died due to the secondary crisis. So really a major impact. And in addition, we're seeing increases in financial barriers. And Mamta talked about the importance of the access and the financial access. And over the last 18 months, we saw in this data that it has become harder and harder for women to access services due to financial reasons. So you asked about the strategies and what's next. And I think, first of all, it's really important that solutions are local. And so GFF model therefore focuses in very close collaboration with the World Bank and other partners on supporting the countries to set their priorities and to ensure that in the COVID pandemic responses, there is equal attention for the pandemic and the COVID cases itself, as well as for essential services for women and children. And the essential services grants that we are able to provide linked to World Bank financing from IDA is a really good way of also supporting the funding gap and ensuring that we can really double down with countries on providing these frontline services. And so that's really the focus of the campaign that many of the panelists have talked about. But also wanted to say that we're very excited that because of the generous contributions from our partners so far, we are able to issue 6 new grants today to Sierra Leone, Uganda, Ghana, Cambodia, Indonesia, and Burkina Faso. Thanks, over to you, Alva.
Thanks, Monique. Noliette, I wanted to come back to you. And I guess one of the things that I think the pandemic has also highlighted is a need for localization and the role of local organizations. And, I think one question I have for you is, how do you think local organizations can be better supported by funders? Do you think you have enough voice in some of these processes? What do you want to see happen from here?
Thank you, Adva. First of all, I want to talk on the point that Monique has mentioned, that solutions are local. And Dr. Chris has talked about the government needs to work together with the partners, need to work together with civil society organizations, need to work with the communities, because first of all, we need to understand and agree that communities are the ones that are really at the center of the response. All the issues that we have, if they are not part of they are not at the center of the response, they are not at the table to take decisions that are really responding to their needs, then we want to be doing the things in the right way that we're supposed to be doing. The communities are the ones to create the demand to come and access the available services, more especially those ones related to women, adolescent girls, and children. So we need to make sure that these groups are at the center of decisions that are being taken, because they're the ones who are facing problems, and they're the ones who need to bring their needs. And then we are able, the partners, the government, they are able to provide solutions to the right needs of the vulnerable women, adolescent girls, and children. And something else I want to highlight is about the accountability. We are talking about resources, we are talking about services. We have seen how the COVID-19 pandemic has impacted the lives of women, children, and adolescents. We've seen how the government have been pushed to reallocate resources for other health services to the critical gaps that have been highlighted by the COVID-19 pandemic. But how were these resources utilized? How were the priorities identified and put in place? The plannings, were they done properly? So the monitoring of those services, where the resources for other health services were allocated to, how were they being monitored? So we need also to think about that. So coming back to the civil society, I want to commit, for example, if I share the example of Rwanda, where the GFF is helping to facilitate additional domestic resources for social protection and health programs. So also including the commitments for improving childhood nutrition on early childhood development. So here, through Rwanda NGOs Forum is hosting the GFF Civil Society Coalition. So through this GFF Civil Society Coalition, we are engaging at the national level in all the plannings to make sure that the community needs, mainly the children needs, the adolescent needs, and the women needs are prioritized. So we are there to provide a strategic guidance in terms of the interventions and priorities that are being put in place. We are there to make sure that during the implementation, are we part of the process in the implementation? If it comes to monitoring, the oversight, are we part of the oversight committee that is conducting the monitoring? So that we are able also to advocate, because the civil society organizations, they're the ones who are close to the community, they're the ones who are able to hold the government accountable to bring on the table issues that are not being addressed. So we need to be there, part of all the processes. So we are working together with the government to make sure that all these, we are advocating and raising the voices of those who are in need. So as the commitment for civil society, I would mention that I would want to talk about we need to bring the civil society and the youth constituency has been deeply engaged in the GFF since its inception. It has brought up a deep expertise. They have worked on the connection to the communities, and also they have brought in the experience in terms of advocacy and resource mobilization, but also working on the accountability. A very small example an example that I can just mention here is about the GFF Wall of Fame, where the civil society and the youth are celebrating the critical contributions of donors, the country government, and the civil societies. So I think this needs to be highlighted. Why are we celebrating? We are celebrating those critical contributions because there are lives that have been saved, but a lot needs to be done so that we are able to save, we are able to maintain the gains that has been achieved in the previous years before the COVID-19 has come up. Yeah.
Wonderful. And we have shared a link to that Wall of Fame in the chat for those of you who want to check it out. Jennifer, I want to come to you. I know that USAID is thinking a lot about localization, and there was recently a congressional hearing on the subject. How is USAID looking at how it's working with local organizations, how you're funding them, how to increase sort of the number of local organizations that you're working with, especially given Noliet's comments now about how well they know communities, how close to communities they are, and they are often sort of the best potential providers for services and for understanding the true needs.
Yes, thank you. Completely agree. And I guess I would report that USAID, particularly in the health sector, has seen a very dramatic increase in the last few years in the support that we provide to local organizations. I think I could again give the example of Mozambique, where in the 4 years that I was in Mozambique, we more than doubled the number of local organizations that we were able to support directly, not through any kind of an intermediary. There's a lot of attention to this right now within USAID, and it involves both work at the headquarters level, trying to move forward on facilitating a change in policies and procedures that would allow an easier road to supporting local organizations, and also a lot of communication between the headquarters and both our field missions and the local organizations that are in country and wanting to work with USAID. So we want to have that kind of consultation, not only with our own internal people, but also with the organizations, in part to know what they want and to know what kind of support is best suited for them, achieving common objectives, common development health objectives, but also longer term institutional strengthening. So this is definitely a focus at USAID. I think we've made progress, and I think we hope with this renewed attention in this COVID crisis to be able to move forward even faster. Over.
Thanks. Chris, I want to come back to one of the things you were talking about, which is, this issue of access to care. And we heard from the minister that we've seen this cycle before. As crises emerge, access to care drops off. And then we see some of these negative consequences. As we're looking ahead, there's a lot being made about, how do we come back from the pandemic? We're not out of it yet, but as the response and the sort of longer term response happen simultaneously, what do you think needs to be done to address that sort of fundamental challenge around continuing access to care in times of crisis, of sort of improving that resilience? What do you think are sort of the key components to addressing that?
Yeah, thanks, Adva. I know we're short for time, so I'll be brief. I mean, I think a little bit like my oxygen example, building resilient primary healthcare systems was something we were doing and making incremental progress on before the COVID pandemic. I think the COVID pandemic highlighted just how not resilient many health systems were across the world. That's actually true in rich countries like the US as well. And so hopefully the pandemic will give us the will and, ultimately the political support and finances necessary to build much more resilient health systems so that when they face shocks, it's not if they'll face shocks in the future, it's when, they're more resilient and they don't show the weaknesses they've shown in this pandemic. The second thing I'd say is that as we turn our eyes out of this crisis, which isn't done, to the future of pandemic preparedness and response, building those early alert and warning systems, having a better surveillance system so that we can find new emerging threats, particularly infectious disease threats, earlier, because the sooner you respond, the smaller you can have that problem and the less disruption it has to the system. So I think we have to both be better prepared in the future, as well as continue to invest more and do it more quickly in terms of making progress in building resilient health systems. Over.
Thanks, Chris. And Monique, I want to come to you, and then we'll have a lightning round where I'm going to ask each of you about a sort of personal commitment or call to action that you want to share. So get ready for that. But Monique, wanted to pick up on something Noliette was saying, which is on the accountability piece. So you're helping governments do a lot of this planning. How are you looking at accountability and helping hold them accountable to some of the sort of plans and commitments that you make together?
Great, thank you. And so many things here. I was so happy with Noliette's contribution and the example, because it's such an important example. And so there are various pieces to it, but I'll highlight two because of the time. One is that it's really very important that in supporting the country leadership, there's a transparent and inclusive process. We call it the country platforms, where there are really the evidence-driven discussions that are transparent around what are the priorities and where do the investment need to take place. And then secondly, and that builds on what Chris was saying, I think our collective effort, countries with the global community really need to double down on the frontline services and ensuring that accountability on community level really helps also in that feedback loop to ensure that there are quality services for all people. And so from GFF and World Bank perspective, we will particularly focus on those that are most affected by the pandemic and were already in really challenging and marginalized situations. And so the equity aspect here is really very, very important. And maybe just say one other thing, and that's part of a commitment is to really ensure that this agenda is fully financed. And I want to just thank the government of the Netherlands, who is doubling their contribution to the GFF today and announcing that today as part of the RM campaign, in addition to other commitments from Gates, Canada, Norway, and others we already received. But we're not there yet. And so we will continue to ensure that we can successfully complete this and support all GFF countries in this agenda. Thanks.
Thanks, Monique. Noliette, do you have a sort of commitment or call to action you want to share with us?
Oh, thank you, Adva. Part of the commitments is that civil society organizations are deeply committed to ensuring that the GFF is fully resourced in order to maintain critical progress and essential services for women, children, and adolescents. And also the GFF country-led approach continue to help to improve sustainable primary care systems, including strengthening supply chains and expanding the health workforce, also scaling up data and digital innovations, because at the end, they are all essential to COVID-19 response and also other quality health services for women, children, and adolescents. Then what I can end up with is that we urge the donors and the country partners to sustain the legacy of hard-won progress towards preserving essential services for women, children, and adolescents, and invest in the GFF to ensure a future that delivers healthcare and rights for all. Thank you.
Thanks, Noliette. Jennifer.
Thank you. I would say USAID is more committed than ever to partnership, and that includes the GFF, that includes the World Bank, includes the Gates Foundation, includes the countries and the ministries and the NGOs where we work. And I think one thing we learned for sure out of COVID is that nobody can do this alone. We're all in it together, and we need to keep those partnerships as vibrant and as strong as possible.
Thanks, Jennifer. Chris.
Yeah, I think as we go forward, I think just redoubling our focus on primary healthcare systems, which are at the base of protecting women and children's health and can meet or prevent most healthcare needs. And working closely with the GFF, obviously, but also the World Bank in general. I don't know if you had a chance to look at their primary healthcare flagship report, and that focus on primary healthcare is one of the best bets as we go forward. Resources will be constrained, but I think it's one of the best investments we can make in improving those systems today, as well as making them more resilient for the future. Over.
Thank you. Well, thank you to all of you for this wonderful conversation. I know we could probably continue it much longer, but we do have some time constraints, and we have a really great closing speaker to help us sort of reflect on the event. So thanks again to all of you for joining us. And to close our program, it's my pleasure to introduce the Honorable Margaret Muhanga, who is the Minister of State for Primary Healthcare in Uganda. Minister Muhanga, thank you so much for joining us today. And for offering some closing remarks. And I'm hoping you can share some of your perspectives. We've heard so much about the importance of really listening to countries about their priorities. So share some of your perspectives in the context of your work in Uganda and any reflections on the conversation today.
Thank you very much, DEXA and the Global Financing Facility, GFF, for convening this important discussion, and to all the distinguished speakers and participants joining in today. I'm honored to reflect on today's discussion and briefly share with you the experiences of Uganda, including how we responded to the pandemic, our challenges, and how we are planning for an inclusive recovery at this point in time. In Uganda, we were able to draw on our past experiences with Ebola. We've had Marburg and many other pandemics, even HIV/AIDS. So when COVID was declared a global pandemic, we were at least having some kind of background to how to fight these pandemics. Our earlier investment in pandemic response and strong political leadership meant that we had built robust systems, we had capacities and networks to fight this particular pandemic. Of course, nobody could have imagined how long this unprecedented crisis would continue for, and its far-reaching implications. We are all seeing now that it's not ending soon. Today, many of the speakers made it clear how COVID-19 is no longer just a health crisis or a health threat, but it's also an economic one. This leads us to even tighter fiscal space for the government, and in the context with many competing priorities just in the health sector, from HIV, malaria, maternal and child health issues, all those services lay a burden, and also on non-communicable diseases. All these lay a burden on our health sector. The economic recession is hitting communities hard as well. Families who typically finance around 40% of the health services no longer have these resources. These same households are also home. Children and adolescents who have not attended school for nearly 2 years. We are very concerned about the health impacts, including teenage pregnancies, which are really high in Uganda. We've had so many kids who were out in the lockdown who are now mothers. These long impacts on the labor market and opportunities for these young people in the future, they won't be having opportunities. I hear all of you distinguished speakers calling out loud and clear, not just for a response to the pandemic, but to deliberate actions towards laying the groundwork for an inclusive recovery. From where I sit, I couldn't agree more. Yes, this is a crisis, but also an opportunity for us to correct these long-standing inequities, to build up back stronger. We need to rise stronger after this pandemic. The pandemic has actually shone a light on inequalities within countries and across the world. With additional support from the GFF, we can use this moment to transform primary health care towards a more integrated approach that centers health system users at the stages of the life cycle. We also have an opportunity to move away from the vertical approach and build the capacity of community health workers to provide integrated community-based health services, yes, for COVID-19, but also for illnesses, diseases, family planning, and routine health services. To do so will require a whole of government investment strategy, alignment and support from our partners to continue our investments in health and human capital. I am confident that we will achieve our ultimate goals with partners such as all of you, ensuring that people can access quality healthcare, rebuild their livelihoods, and emerge from this pandemic stronger together. I thank you all, and may God bless you.
Thank you so much, Minister Mohanga, for those closing remarks. And I'll just thank everyone again for joining us for this wonderful and really important discussion. And just let you know that, if you've enjoyed this discussion and you're interested in learning more and keeping on top of the latest trends in development financing, check out a weekly newsletter I write called Devex Invested. We also have a weekly newsletter all about global health that comes out every Thursday called Devex Checkup. My colleagues do an amazing job of bringing you the latest trends and information. It's really a must-read newsletter on global health. So with that, I'll just thank you all again for joining us, and thank you, GFF, for partnering on this event.